On this week's Cardiology Countdown, we'll talk about high sensitivity troponin in the outpatient setting, also a look at prevention of cardiomyopathy following chemotherapy, as well as diagnosing endocarditis. So first up is a study from the Heart and Soul study, which looked at just under 1,000 patients seen in outpatient clinics, where the new high sensitivity troponin was measured. And we might all be alarmed to hear that 80% of our patients in a cardiology outpatient setting had positive high sensitivity troponin. And this was subsequently correlated with development of cardiovascular events. And when controlling for other factors, this held up as a significant predictor. Of course, we need to develop algorithms on how to use this in the outpatient setting, but I think illustrates the fact that our patients who are seemingly stable may be able to be diagnosed with this high sensitivity biomarker in the future. Next up, we'll turn actually to endocarditis diagnosis, which traditionally is done with echo, blood cultures, and there are Duke criteria of major and minor criteria for diagnosing endocarditis. A group of investigators looked, and this was published in JACC, at use of FDG-PET and CT to try and enhance diagnosis of endocarditis. They studied a series of 72 patients with suspected endocarditis, of whom 50% were found to have abnormal FDG-PET uptake. The overall sensitivity and specificity were 73% for sensitivity and 80% for specificity, so not a perfect test. But when added as a new major criteria into the Duke criteria, that would be positive blood culture and echo evidence of a vegetation, this improved the overall sensitivity and specificity, or sensitivity up to 97%. And so an evolving possible addition, an adjunct for imaging patients with endocarditis. And then our number one pick this week is a randomized trial also published in JACC called the Overcome trial that looked at the very difficult problem of development of cardiomyopathy in patients getting chemotherapy. This was a study of 90 patients who had either acute leukemia or malignant hemopathies undergoing bone marrow transplantation. And they were randomized to receiving standard therapy or early enalapril and carvedilol. And these were patients starting out with normal LV function. And they looked out at 6 months and found a significant avoidance of fall in ejection fraction, where the control patients had an EF fall by about 3%, and no change in those who were treated with the beta blocker and ACE inhibitor. They found also a reduction in the rate of death or heart failure, 6.5% versus 22% in those treated versus control, and the overall rate of death, heart failure, or low ejection fraction, similarly 6 versus 24%. And so I think very intriguing data on the primary prevention of heart failure with early institution of beta blocker and ACE inhibition in patients undergoing chemotherapy. So for this week's Cardiology Countdown, I'm Chris Cannon.